Toxic multinodular goiter. So this is the second part. So in the first part, I have briefed about the treatment related to the toxic multinodular goiter, where the treatment options are, or the most important treatment being, you have to burn out the toxic nodule, which scientifically we call as radioablation. So we start with antithyroid drugs, and we need to do radioablation. Along with it, you will get beta blockers to control your heart problems, and we have options for surgery also, thyroidectomy. So in this video, I'll brief you about how we do a thyroid scan, and when we have a diagnosis of toxic nodular goiter, how we'll go about, how we'll do a ablation also, and what are the precautions to be taken. Now, from your center, you will be referred to a higher center. So before that, you need proper preparations for that. Why? What they are going to do in the higher center is, they are going to give a radioactive material which is going to get concentrated in the thyroid gland, and we want the best results. For that, the iodine level in your body should be least. So what we are supposed to do? You are supposed to stop all the iodine input from the diet. So I'll give a list of food items which contains high level of iodines. Fish, seafoods, egg yolk, milk related products, and some drugs which which can interfere with the metabolism in the thyroid gland, like steroids, multivitamins, nitrates, and we have one more multivitamin which I already mentioned, and cough syrup, and antihistamines also. These are the common ones. So all this to be stopped. Most important being the iodized salt which you use at home, or any product which is fortified, maybe they have iodine also in that. Even that to be stopped. Why are we doing this? Because the iodine level should be least. How are you going to know that? By doing a blood test, TSH level. How much? It has to be, the level should be more than 30. The normal level being 0.5 to 5. If it is more than 30, that means you are fit for scan. So you have been prepared by your doctor, you are referred to a higher center, you are going there. First thing, after you're knowing all your identification, everything, identity, everything, after opening a file, the concerned doctor, they're going to ask you by showing a list, have you been taking all this for all these weeks, for past 4 to 6 weeks? Have you stopped all this? The answer is going to be yes. Okay. Have you done the TSH blood test? Yes. How much is that? You show the report to them. It's more than 30. So next, they will repeat TSH and a few blood tests, and they'll give you a date. That will be the nearest date. So you are ready for the radioactive iodine scan. Now, this radioactive iodine scan, how much iodine to be given to that particular person? That there's a protocol for that hospital. Either it can be a fixed dose, or they'll find out how much is a safe dose for you. That is, they'll do an iodine dosimetry. Scientifically, it has been proved that either way, whether it's a fixed dose or iodine dosimetry, both way, the effect and the side effect is almost the same. You don't have to worry about that. Now, the day has come when you're going to get when you're going to do the thyroid scan. This is going to be an OPD procedure. So the material which you're going to use is technetium scan. If it is a technetium scan, then it is going to be an OPD procedure. If it is an iodine scan, then we have to see you the next day. That means it is a one-day procedure, next day. So what are we going to do? That particular day, we'll give a capsule or something to drink which contains radioactive material. If it happens to be technetium, the report will be given to you, will be read. We'll keep a gamma camera in front of the neck, and we'll know the iodine uptake dosimetry within half an hour. So you can know the report same day. If it is iodine, it has to be you will do the take the report the next day. So the topic of discussion is toxic multinodular goiter. So the report is going to be positive. It is toxic multinodular goiter. Now, being an OPD procedure, it is done and you are going to be discharged. So what are the precautions to be taken? And why the precautions in the first place? Because what you have taken is a radioactive material, and this radioactive material is going to get emitted from your body for 2-3 days. So for 2-3 days, this effect already you're going to get a effect, the side effect. This should not spread to other person who is going to be near you. So what are the side effects in the first place? The side effect being you have swelling of the neck, you will be tired, and the salivary glands, either both sides and here also, this will get swollen up and it will be painful. These are the common side effects. I'll tell you how to manage that. And at a low dose, the chances of bigger complications are less. I'll tell you what later. Now, you have been discharged. There are so many advices for that. I'll tell you one by one. So when you go back, you are supposed to go back in a private vehicle only. Do not use public transport. And in that private vehicle, your co-passengers or whoever has come to help you out, they have to distance themselves as much as possible. When you reach your home, you will be given a separate room which is bath attached, and if possible a small balcony also. And in that room, you are confined to that room for 2-3-4 days. And your breakfast, lunch, dinner, tea, coffee, whatever, that will be kept outside your room. The person who comes and serves you, they'll keep it outside, they'll knock and they'll go off. You open, take your food, finish off all your meals. You have to wash your utensils and keep it back in the same place, outside. The person who comes and takes that utensil, they will not mix this utensil with a general utensil in the kitchen. They'll maintain it separately. When you use your comfort room, you have to flush your commode 2 times. When you brush your teeth, when you spit in the sink, you have to clean it up 2 times. And whatever material you're using or cloth you're wearing, you have to clean up yourself and use the balcony to dry it up. In short, nothing goes out of the room. Nobody comes into the room. You should distance yourself from everyone, especially children, pregnant ladies, old people. No physical contact with your husband. If it so happens to be a female, which is more common in females, no physical contact with your husband. So nothing goes out of the room. So these are the precautions to be taken. Now, you have to take your food 3 times only, even if you like or not. Drink a lot of water, plenty of water, and balanced diet. Avoid oily foods. Take more of vegetables and fresh fruit juice and lemon juice specially. Why? See, this radioactive material is going to be concentrated in your salivary glands. So you have to flush it out. So this lemon juice, drinking lemon juice is going to help you out. It will reduce the pain and the swelling also. These are the precautions. You have to take it at home, and as much as possible, be ambulant in your room. So by 3-4 days, you're back to normal, and the report has come positive for toxic multinodular goiter. So you will be already been given a date to come back to do ablation. So next is radioablation. So radioablation, you have a date. So this time for radioablation, it is going to be a higher dose of radioactive material. So the side effect is going to be more. So we need to admit you this time. So what are the side effects this time? More of tiredness, you may vomit, and your blood count may come down. And that means the radioactive material can affect the bone marrow, and there will be neck swelling, especially the salivary glands. So what are the long-term side effects? What I have told you are all side effects only for a few days or say a week. The long-term side effects being you can develop any other malignancy in the body. Please do not be worried about that. The possibility of this is very less. So this should not stop you from taking radioablation. You can very well go ahead and take radioablation. The possibility of getting a malignancy, whichever I have named, is very less only. Now you are admitted, they'll start an IV drip, and they'll give you some antiemetics also, and your radioablation iodine or radioactive material has been given to you. So they'll check the blood test every day, and suppose their blood count is less, the appropriate treatment will be given. Now you will be in the hospital for 3-4 days till you become normal or normal enough to be discharged home. When you are discharged, now the same precaution which you are taken for initially for thyroid scan, the same precaution applies here also. So you go back home, you have in a private room, a private vehicle, social distancing. You have a separate room in your house with a bath attached room and a small balcony if possible. Breakfast, lunch, dinner, your tea, coffee, everything been served there. Utensils maintained separately. When you go to the restroom, you had to flush out twice. When you spit in the basin, you had to wash twice. All your dress you're going to maintain by yourself. Nothing goes out of the room. No person comes inside the room. So this will go on at least for a week this time. Now, the final question is, one important question, is that all? Have we done with the treatment? Possibly yes. Why possibly? Why you didn't tell me yes? Because when we repeat the scan, maybe after 6 months, suppose if there is toxic uptake again, we may need to repeat it. Is there a possibility? Yes, there is. The possibility is very less. So if in case I need one more, is that the final? Almost. Oh, why almost? Maybe you need one more exposure. So how many more I need? No. Please don't be upset. Usually one will be enough, and maybe a second one. Third one is going to be very, very rare. So maybe one more, that's all. Now, when you are discharged now, you will be on anti-thyroid drugs. Why? Because when you are exposed to radioablation, what happens is the thyroid hormones which is inside the active nodule, it gets filled up, it comes in the blood. So we'll be in a hyperthyroid state. So we have to control that. So for that, we'll give you anti-thyroid medication as well as beta blockers. For how many days? For a month or so, till your TSH becomes normal and the T3, T4 comes back to normal. So your change, we'll change the medications only when the thyroid function test becomes normal. So that is all about thyroid scan and thyroid ablation. See, the thyroid scan, it cannot be done for everyone. Suppose the patient happens to be pregnant. What will you do? You cannot expose her to radioactive material. So what are the indications for thyroid removal surgery, like thyroidectomy? Suppose the thyroid toxic nodule is big one, say especially more than 5 centimeters, or the patient happens to be pregnant, or anti-thyroid medication, the patient is not compliant to it. All these patients, it becomes difficult to control the toxicity related to the nodule. So in that case, the treatment is going to be surgery, that is thyroidectomy. So thyroidectomy is near total thyroidectomy or subtotal thyroidectomy. Remove as much thyroid nodule as possible, thyroid gland as possible. Suppose you want to know about thyroidectomy in detail, what are the indications in this condition? What are the precautions to be taken? How long the surgery takes? How long you have to be in the post-op ICU, intensive care unit? What are the complications related to surgery? How we manage the complications? And how long you have to take rest? What are the do's and don'ts at home? If you want to know, just enter Dr. Zakir Hussain ENT, multinodular goiter, English. In that you have 3 or 4 parts. I think you check in 3rd or 4th part, that is related to surgery, thyroidectomy. You will get all the details related to this. So this is how we manage toxic multinodular goiter. So this is treatable condition, but we need a teamwork. It's not ENT alone. We get help from endocrinologist, from the nuclear medicine department also, and of course the oncologist, onco department also. So that is all about toxic multinodular goiter. Thank you so much.